Okay, welcome to the dissection of the heart. This is a cow heart, so it's very massive, but hopefully I can show you all the parts on it. Okay, first thing I like to do is have you orient the front from the back of the heart, and this would be the front of the heart over here. And in the back, you can kind of tell the back easier because it's got this fat, ring of fat around the back. Okay, next thing I'd like you to do is look at the different arteries coming out of the top of the heart. And so first thing, I always follow the blood, deoxygenated blood coming into the heart through the superior vena cava and inferior vena cava, and it's going into this vessel right here into the right atrium. And then if we look at some of the other vessels, we have the pulmonary arteries over here. This is going to be the aorta over here, taking oxygenated blood out to the rest of the heart. And so you can see the cow has nice big vessels on the top. But okay, so then to dissect the heart, you take the front from the back, and I've already kind of done it, even though I didn't quite get it in half. But the thing to always remember is now we've cut it in half, so this is going to be the right side of the heart. The inside is going to be the left side. So following that deoxygenated blood, again, the inferior and superior vena cavas comes into the right atrium of the heart, and follow the vessels through the heart and the right atrium. Then from the right atrium, it's going through this valve right here. This valve is the tricuspid valve. Tricuspid because it has 3 different flaps, and you can see how it attaches to the papilla of the bottom chamber. On this side is the ventricle, so this would be the right ventricle. So we'd have the right atrium, the tricuspid valve into the right ventricle, and then that deoxygenated blood is going to go out through the pulmonary artery out to the lungs, and it's going to get oxygen, come back in the pulmonary veins into the left atrium. Left atrium would be on this side. Left atrium, and I'll open them up, you can see them a little bit better in there than, and especially on that side. But anyway, so we're into the left atrium. The valve on this side is the mitral valve or the bicuspid valve, so it has only 2 flaps. And then it's going to go into the left ventricle. And then from the left ventricle, that's oxygenated blood, so it's going to be pumped out the aorta to the rest of the body, and you can follow the vessel up through until you get, it's like, okay, there's the aorta. Okay, the other thing I like students to kind of notice is that the walls of the ventricles, the center section that divides the ventricles is the septum of the heart, and the wall on, if we have again the right side of the heart and the left side, the walls on the right ventricles are actually skinnier than the left side, and that's because the right side is only pumping deoxygenated blood to the lungs, where the left side of the heart is pumping oxygenated blood out the aorta to the rest of the whole body. And I'm trying to think if there's any other parts, but what I'll want you to be comfortable again is deoxygenated blood comes in the superior inferior vena cava into the right atrium, through the tricuspid valve to the right ventricle, out the pulmonary artery to the lungs, back in the pulmonary veins to the left atrium, through the bicuspid or mitral valve to the left ventricle, and then out the aorta to the rest of the body. And I think, and the bottom of the heart is the apex. Generally, apex is on a top side, but of the heart, the apex is on the bottom. And we don't talk about in here so much, but the cardiac arteries and veins, the arteries that feed the heart muscle itself. And you have a right coronary artery on this side. You have a anterior descending, which would be down through here, and of course the posterior descending would be down through here. Okay, and that's it for the dissection of the heart.